Welcome everyone. Thank you for joining us for the Vanderbilt Epidemiology Center Health Equity Seminar this week. I'm going to ask you to just put your questions into the chat or save them for the end. You can ask them yourselves at the end, but we'll let Tara speak and then we'll do questions at the end. I'm very pleased to welcome our speaker today, Dr. Tara McKay. She is an assistant professor in the Center for Medicine, Health, and Society here at Vanderbilt University. Prior to joining the Vanderbilt faculty in 2015, Dr. McKay, Robert Wood Johnson Foundation Scholar in Health Policy Research at the University of California, Berkeley, and the University of California, San Francisco. She received her PhD and master's in sociology from UCLA, and prior to that, a bachelor's in psychology from Occidental College, also in Los Angeles. Dr. McKay's research focuses on the sociology of health, health policy, and LGBTQ health. She works globally in not only in the US, but also across a variety of countries in Africa, including Malawi, Mozambique, Nigeria, Senegal, and Uganda. She has published a number of policy briefs and white papers, and most recently in 2020 has published research briefs on the impact of COVID-19 on LGBTQ Americans and sex relationships and COVID-19 sexual behavior change among gay and bisexual men in the US. She currently has an R01, which is studying the effects of social networks and policy content on health among older sexual and gender minorities in the US South. And she's going to speak to us today about her work on COVID-19 among LGBTQ communities in the US and globally. So welcome, Dr. McKay. Thank you for being with us.
Thank you so much, Lauren. It's really a pleasure. I'm glad to be a part of this. Sharing some slides here today for you, and we'll be having conversation about some of the work that we're doing here at Vanderbilt. As well as some of the things that I was able to kind of garner from the world in terms of other things that people are working on, thinking about impacts that people are expecting. There we go. I want to give us kind of this overview of thinking about why we're here, what we know now, what's being done, and some of the lingering concerns that I think are out there. And I start with why we're here when we're thinking about LGBT health and COVID, because it hasn't been obvious to everyone why we would expect some differential effects here, why we would expect that there might be disparities by LGBTQ status or identity in COVID effects that could be physical health or mental health or economic effects and so on. So I want to just kind of paint that picture for you, give us a really clear idea of why we're here, what's at stake. And some of that is coming from some reports that came out fairly early in the pandemic for the US, so around February and March, that we're thinking about increased risks of infection. So LGBTQ Americans already had higher levels of various underlying health conditions. We have a lot of work suggesting that there are different health disparities that already existed, and some of these are particularly important for COVID-19 susceptibility or risk of severe disease. Some of those are things like HIV, which suppresses the immune system, as well as other kinds of conditions that have been identified as potential risk factors for serious disease or death. And those are things like heart disease, obesity, diabetes, asthma, tobacco use, all things that we already know pre-pandemic have a higher prevalence in LGBTQ populations. There are also some increased risks for economic impacts. So pre-pandemic, we already also knew that LGBTQ Americans were more likely to work in certain industries versus others. The industries affected by the pandemic in terms of closures, job loss, wage loss, are all industries that LGBTQ Americans are more likely to work in, that we know that 50% or more, this is an estimate coming from Vanderbilt University's Gilbert Gonzalez, 50% or more might lose their employer-sponsored insurance or could stay uninsured as a result of pandemic impacts. 60% are renting their home, so they're economically vulnerable in the kind of current rental evictions crisis that we are facing as a country. And then compared with different sex couples, LGBTQ couples raising children, we already knew also had lower incomes and higher rates of poverty than opposite sex couples raising children. So there are also some risks to others as well, including children, that we might be concerned about here. Additionally, there are some increased risks of social impacts. So some members of our communities have already been socially isolated, especially older gay identified men who more often than others report that they don't have someone else that they could rely on for various kinds of support or live alone. LGBTQ folks are also at higher risk of becoming disconnected from some of those critical social supports that they've built, which have been kind of necessary in cases of trying to avoid unaffirming family members and so on. This is also very important for people who are engaged in substance use and recovery programs like AA, for example. These are all kinds of things that were relationships and linkages, connections to community that people felt were disrupted by the pandemic. Certainly that affects people overall, but some of the kind of underlying contours of LGBTQ Americans make this more likely in their case. There are also some special circumstances that people have been interested in, researchers here at Vanderbilt have been interested in, and that is that while kind of events have affected large swaths of a population. For example, in March, more than 14 million college students were sent home, kind of the rug pulled out from under them as a result of COVID-19, lives disrupted, education's disrupted. Some folks have been interested in how this combination of stressors, going home, but also being LGBTQ identified might compound some of the effects of these life disruptions for specific segments of the LGBT population. So that's kind of why we're here. So what have we kind of found out? What do we know? What are we thinking about right now? I'm going to tell you a little bit about a few different studies. On the left-hand side of your screen are some advertisements for a study that we were able to field in April, beginning in April. And it continued through early May. And we were primarily interested in tracking the impact of the epidemic on LGBT Americans. So we did a national sample of LGBT folks. This was kind of primarily social media based. And we were able to get a sample of about 2,000 people to respond to a quick just snapshot survey, thinking about what kinds of effects they were experiencing, what kinds of behaviors they were adapting. And then members of our team also had specific interests in how COVID might be affecting sex and relationships. So we also had some detailed sections on that as well. I'll also be talking about what we call VU Snaps, which is that R01 that Lauren mentioned in the introduction that I'm running. So this is a study looking at older LGBT folks in particular in the South, in Tennessee, North Carolina, and Alabama. And we had always planned to open enrollment in April of 2020. And so we decided to kind of keep that timeline and add some measures thinking about COVID-related impacts. So I'll tell you a little bit about some of our findings there as well, specifically for older LGBT folks in the South. And then finally, I'll mention a study that has been led by Gilbert Gonzalez and some other students that was done over the summer, which they were very kind to include me on, which is about LGBTQ college students and basically the impacts as they were sent home and how they experienced some of the pandemic stressors as well. I'll acknowledge here that none of these things, this is a lot, right? None of these things would be possible without all of these lovely faces you're seeing, the LGBT Policy Lab in general, as well as Gilbert Gonzalez, who I work with regularly. We've been able to kind of pull Christopher Purcell for LGBTQI Life into our research endeavors. I've also been able to kind of keep working with some key private sector research groups that focus on LGBT health called the Henney Group. And so I've named them here. Jeff Henney is the director of that organization, and couldn't do any of this work without Sergio Garcia, who also works at the Henney Group, as well as all of these lovely faces, our VU staff. Kateri Kelly, who's in that top left corner, runs the VU SNAPS project. Without her kind of day-to-day vigilance and recruitment efforts, we really would not have any data to kind of convey to you. Bailey Villa is the next over on the staff line, who is a program coordinator at the Women's Center, who in April and May took time out of her life to help us present some material to the mayor's office. On this bottom row here, this is all of the postdocs, graduate students, and undergraduate students who've been involved. Matthew Facciani, Kyle Gavlik, Lily Jaremski, Emilio Lorette Demola, Hannah Nessen, Harry Barbie, Lena Robertson, Eliza Blades, and Elise Rosalie Ecre. Really, without all of these people, we would not be able to kind of have a lot of information to share with you today. This is, I think, for many of us, like the moment of the team. There's no like standalone, isolated academic thing happening right now for many of us. And thank you all to those of you who are on the call for kind of being involved in some of this work. So let me tell you a little bit about what we're finding. I'll focus first on this national sample of LGBTQ Americans, which we fielded from April 10th to May 10th. The sample size is around 2,000 and is generally close to representative. It's a social media sample, so it does skew young and more educated. But some of the things that we're finding are kind of indicative of some of those expected disparate effects that I mentioned in the intro. In particular, we find that about 18% lost their job from April 10th to April 30th. And this is a little bit higher than that national unemployment rate for April, which is 14.7% as reported by the Bureau of Labor Statistics. And of course, we see higher rates of job loss among lower wage workers, among Black and Latinx respondents, among younger folks that are consistent with some of those expected kinds of contours of inequality and likelihood of job loss here. About a third reported reduced wages, and a third had difficulties getting enough food. This is a bit higher than national estimates for April 2020, which come in at about 20%, and which were kind of largely credited to increases in unemployment during this period. Additionally, we asked about access to care and use of care. At the time in April and May, about 60% reported that they were avoiding routine medical care. This is things like checkups or dental visits. This is certainly expected. A lot of appointments were canceled during this time, either through necessity or through kind of avoidance of unnecessary kinds of care on the part of the patient or client, but would certainly be something that we would want to see kind of reintegrated for preventative care purposes going forward in order to avoid kind of future problems down the road with oral care or other kinds of health issues that really rely on early detection. Additionally, some of the concerns that we had were around people reporting that they had difficulties accessing needed medical care. So 27% of people in the survey had difficulties accessing needed medical care, and 17% of our sample had difficulties accessing routine medications. This was particularly problematic for HIV positive individuals as well as transgender people who were the most likely to have medications that they kind of were needing and having those difficulties that they were reporting as well. Looking now to kind of some of our findings for older adults in particular across the US South. Some of the things that we find are certainly consistent with what we see kind of in general for the population, but I want to kind of stress that again, they're just kind of exacerbated here and presented in ways that we just want to be concerned about and paying attention to going forward. Overall, many people in this survey, this older adult sample, which is age 50 to 76, kind of roughly that baby boomer cohort, they're doing okay, right? I wouldn't say necessarily everyone's thriving, but people are doing okay. And on the margins, though, we certainly have many folks who need other services, who are having difficulty connecting to those services, to other people, to the communities that they formerly relied on. So for example, 1 in 4 of our older adults reported feeling isolated every day in the last week. And this is kind of covering a period that's April 1 to the present, so really the last 6 or 7 months or so. And that's not like 1 or 2 days or 3 days a week I feel isolated. That's I feel isolated every day of the week, 7 days out of 7 days. So certainly something that we would want to be paying attention to. Some of these folks are the most likely to live alone and have other underlying health conditions that we want to be kind of attentive to. And people that really relied on some of those social supports from other community contacts, from community organizations that really just aren't possible right now. Additionally, we're concerned about some of the mental health outcomes for this group. 4 in 10 reported ever feeling depressed during the last 30 days. Nationally, this typically looks like about 10 to 15% of older adults reporting clinically relevant recent depressive symptoms for this age group. So again, that's certainly been exacerbated by the pandemic and potentially by other LGBTQ stressors. One of the things that we have in this survey is the ability to capture some of that qualitative information. So thinking about how people are actually describing their experience. So I've been able to incorporate a couple of quotes for you here on the next couple slides, just to give you that sense of how people are experiencing this moment. And you might kind of find yourself nodding and agreeing with some of these as I go. But really, I'm keep putting these here to really give some voice and give some humanity to these statistics and help you kind of engage with who these folks are and what they're experiencing right now. So this was a quote: "I haven't left my property in about a month. I haven't been in the company of a living human being for about 3 weeks, other than the Walmart delivery guy for a few minutes." We captured this quote at the in our first month of the survey. So we were kind of presenting some information in May to the mayor's office, and this is one of the quotes that we pulled out at the time. And so really some of the stay-at-home orders, the lockdown issues were relatively new at this time, but really just demonstrates that lived isolation feeling. I haven't been in the company of a living human being besides the delivery guy for about 3 weeks at a time when really we hadn't been locked down for very long. Some of that context there. Some other quotes that people brought up also highlight, or some issues that other people brought up also highlight just the connection of LGBTQ issues to other things that we're seeing kind of writ large across the country. So for example, the rental and eviction crisis, this is certainly affecting LGBT folks as well. This quote: "I have no work. I'm only receiving unemployment. I had to make arrangements with my landlord to pay rent as I receive my funds. In 6 years, I had never been late with rent." This is someone who's obviously going through some economic challenges. They're on unemployment and their kind of future prospects of being able to pay their rent are unknown. Right? An additional quote: "My spouse had a significant pay cut at work. I lost part of my benefits package." Kind of suggests that risk of loss of employer-sponsored insurance, of other kinds of benefits that are included with insurance or with jobs. Looking at how people are kind of experiencing this in terms of worry, trust, anxiety, these kinds of things, we also found that people were kind of very attentive to the pandemic. So among older adults, I think this would be unsurprising, but 77% viewed COVID-19 as a significant threat to their health, 68% to their life. Very few had trust that the federal government would be combating the pandemic or could actually report information about the virus accurately. And We saw this certainly as a liability. People weren't kind of paying attention to the federal government or kind of thinking about the information that they were providing, or certainly being cautious about what they're being told here. The opportunity, we thought, was that people's trust in state governments was a bit higher. So one of the things that we tried to convey in May to the state and local governments was that there's really a vacuum here in terms of policy and information, and states can, I think, use that as an opportunity to step in. So over this time period, the last 6 months, about 25% of people in Tennessee agreed or strongly disagreed that they trusted their state government to respond to the pandemic. This was about 32% in Alabama and 83% in North Carolina. We've got some speculation onto why we might see that kind of difference, but we're open to interpretation as well. Essentially, we wanted to convey to state governments that really this is an opportunity to be more inclusive, to be explicit about how you're responding to the virus and kind of fill that vacuum, that gap where people are not trusting the federal government. Finally, I will kind of let you in on some work that is also being led by other members of this team. This was really kind of undertaken by some student investigators, Emilio Lorette Demola, Kyle Gavlik, and Lena Robertson, with the guidance of Gilbert Gonzalez, Chris Purcell, and LGBTQI Life, and myself. Their aim was to survey college students whose lives and educations had been disrupted, who also identified as LGBTQ, and kind of see what the lived realities were in April through June, how people were experiencing this transition, what kinds of concerns that they had, what kinds of messages that they might like to see their university kind of pick up, and so on. And one of the things that we were really kind of concerned to find was that almost half returned to a family that was unsupportive, openly unsupportive or unaffirming of their LGBTQI identity, or didn't know that they were LGBTQ, so they weren't out to their families. And in either of these cases, people felt like they had to kind of go back into the closet to suppress some of their identities or expressions of themselves, which can be quite traumatic, of course, certainly stressful. And so one of the things that we also looked at were the mental health outcomes. So thinking about how many, the percentage that were living with frequent mental distress was quite high, and higher among students who had other kinds of barriers to accessing care, for students who already had unsupportive families, for students who were transgender or gender diverse. And we found that, majority here could be living with anxiety, could be living with depression. They meet the criteria here. And this is again higher for students who didn't have access to healthcare because of stay-at-home orders. There's also some kind of indication that COVID-19 was exacerbating these. So they might be LGBTQ stressors that are combining with pandemic stressors to really exacerbate mental health issues. So when students or a family member or close friend tested positive, we do see that those kind of outcomes for depression in particular increasing. To give you a sense of some of the other work that's going on in this field, I also did a kind of informal social network poll, just to get a sense of what other LGBTQ health researchers were thinking about, what they thought the concerns were, what kinds of findings they had already available, or even inklings of findings that they had available. And so I'm happy to share a few of those pieces with you as well. Some of the things kind of echo some of the things that we're finding in the research that I've just talked about, or they expand on it. So for example, this first piece by Amy Stone, who's a professor at Trinity University, she's been looking at LGBTQ adolescents and young adults in South Texas and found that they are reporting more conflict and stress with family members, especially over the summer around protests and racism. The Guttmacher Institute also has done a national study of COVID effects on women's fertility preferences, really about whether or when to have children and how the COVID-19 pandemic has affected those desires. And they find that queer women were more likely than straight women to report wanting to have children later or to have fewer children. So essentially, folks who've been systemically marginalized, facing other inequalities overall, so including other racial disparities here, queer women were more likely to kind of report fertility preference changes here. Additionally, some work's been looking at COVID-19 effects on access to other services. So a team at Purdue with Daniel Osterl is looking at LGBTQ college students' ability to access resources after experiences of sexual violence during the COVID-19 pandemic. We don't have findings on that yet, but I think certainly one of those things to watch as we try to support LGBTQ college students and think about sexual violence on campus in times when students are more isolated as kind of one of those key kind of intervention points. Additionally, some legal concerns and erosion of rights for LGBT folks have been kind of brought to the fore by Susan Goldberg, who is at Columbia University and who has been examining the new and exacerbated kind of legal risks for LGBTQ Americans during COVID-19, primarily as a result of the federal withdrawal of anti-discrimination protections, but also due to kind of differential terrain of family structures and access to legal marriage and uptake of legal marriage, for example, in terms of family protections, in particular around whether or not people get sick, have access to hospitals, and so on. Outside of the US, I think there are even some additional concerns I want to kind of bring to your attention. So in April 2020, 20 LGBTI people were arrested in a raid in Uganda for alleged non-compliance with COVID-19 related pandemic measures. Essentially, they were all in one location as opposed to spread out across multiple locations, is my understanding. They were a group oversized. And so these individuals were arrested, some were beaten, humiliated, outed, certainly negative outcomes for those people. In Belize, also in April, a 25-year-old gay man was beaten and arrested for allegedly breaking curfew. He subsequently died from his injuries. And in response to these two events, UNAIDS and another international organization issued a joint statement saying that LGBTI people are being singled out, blamed, abused, incarcerated, and stigmatized as vectors of disease during the COVID-19 pandemic. They also stated that violence in state responses targeting LGBTI people were additionally problematic for some of the mental health concerns that we've raised already, vulnerability to unaffirming others in kind of these more isolated contexts, as well as from the perspective of being able to actually do HIV prevention work and kind of continue meeting the demands of other epidemics and public health services in this context that target LGBTI people. Despite this kind of international attention, this also kind of continued as May played out. So in May, the South Korean outbreak of about 5,700 people in early May was linked to nightclubs in Itaewon. And initially, the media had described these nightclubs as gay clubs, which, according to the Human Rights Watch report on this incident, set off a firestorm of online harassment and intimidation targeting LGBT people. And as part of some of the contract tracing efforts, authorities had disclosed personal information about the people who tested positive for COVID-19, including where they worked. And so others used this information to identify infected individuals and put them at risk of discrimination and harassment. Beyond some of these human rights issues, we also have a few different studies that really signal the need for attention to how the pandemic stressors intersect with sexual and gender minority stressors to really affect people's mental health globally. So a few kind of perspective pieces have really focused on this, including one by John Salerno and colleagues looking in particular at LGBT young people globally and kind of this combination of mental health concerns and stressors. In Hong Kong, LGBT adults were experiencing more conflict with family members, kind of consistent with some of that information we see from the United States, as well as reporting reduced connection to LGBT communities. So that need to stay home, that inability to access people in person or community sites, venues, events, all of these things are kind of have been disrupted in ways that are problematic for people who have relied on these communities as family. Additionally, LGBT specific stressors linked to poorer mental health in some of the studies that have come out, including this one. So it's not just that people are experiencing this pandemic and that is kind of the primary cause of poorer mental health outcomes. This study was actually able to look at different kinds of stressors and think about what's predicting poorer mental health, and found that those LGBT specific stressors were better predictor of poorer mental health during the pandemic. And then finally, thinking about kind of new work that's happening now, a team out of the UK, University of Nottingham, Ella Guerin, Beth Jones and Tim Carter, studying the experiences of trans and gender diverse young people during lockdown. Essentially, all of this is to say that people are paying attention to some of these issues and the way that LGBTQ folks are disproportionately or differentially affected by the epidemic, by public health measures to control the epidemic, and so on. So what's all being done? In addition to research, what are we actually accomplishing here? One of the first things that I want to mention is that and our survey kind of supports this, is that many LGBTQ people are adapting to new risks. They are wearing masks at a higher rate than the US population in that April and May, early May period, and they're helping each other. So more than a quarter of our respondents are engaged in financially or physically or kind of socially supporting other people in their community in important ways. Additionally, some of the work that we've been able to do has tried to really focus locally on that impact. So LGBT Policy Lab faculty, including myself and Gilbert Gonzalez, led a webinar with the Metro Nashville City Council and the Mayor's Office to educate them about why we need some of these more inclusive policies, programs, and so on, and to really help them kind of take that next step to being explicitly inclusive of LGBTQ people in their COVID-19 response for Nashville and Davidson County. This had kind of a mixed response. We certainly got lots of positive responses from policymakers, from people working in government and public health, but we did get a lot of kind of more negative feedback from Nashville and other community members who really just didn't, I think, understand why there might be some differential risks here or differential impacts here. So one of those things that kind of continues to need to happen is that education around health disparities and inequalities and how they work. And who's kind of vulnerable from them. We were also able to learn a bit about what other groups are doing and how they're succeeding. Obviously, this is a very short list, but I'm sure there are many, many other great examples. These are the ones I know the most about. Locally, the Oasis Center and Launchpad are really working hard to keep LGBTQ youth housed safely in the pandemic, and this often means kind of finding alternative arrangements other than kind of group shelters or rooms where they would have multiple people staying. So it's been a challenge to kind of find the funding and the ability to do that safely. So that's required a lot of creative response. Nashville Cares has been in overdrive all summer to provide care, medications, and testing to their clients and constituents. And one of the things that we've been able to kind of work with in terms of kind of converting or helping other organizations take that next step has been with 50 Forward. So that's a local organization serving older adults in Tennessee. And they kind of pre-pandemic were interested and had already done a needs assessment thinking about how they might be more explicitly inclusive. And I think the pandemic really put a little pressure on them to make that happen. And so with some coordination between us as well, we were able to help them have some LGBT specific programming, thinking about virtual programming, thinking about how to include LGBTQ older adults in some of what they were doing to kind of show that visibility, to kind of just broaden who they were reaching as well. And then finally, the last group that I'll mention is an international organization called Impact, which took the kind of pandemic moment and leveraged its global network of LGBT and HIV organizations all around the world, over 100 organizations, to reach gay and bisexual men and do some programming around how to keep it sexy while staying COVID safe. So I really kind of appreciated a lot of their content, being frank, open, honest about sexuality, desires, all while this is kind of happening and putting pressures on people to kind of stay home, reduce partners, new contacts, and so on. So how do we do that? Some lingering concerns that we have. The first, I feel like I have this slide in nearly every presentation, but about LGBT health. But the first is that we really just don't have a lot of data on health outcomes here that are identified by LGBTQ status. You can probably think of a lot of reasons why that might be true and why that might be, we might not want those data, right? And if they're collected poorly or identified in ways that are going to be problematic for people's privacy. But there's certainly, that lack is certainly making disparities very hard to track. So we can think about ways to kind of creatively problem solve here to find those cases in other kinds of data sources and think about what the impacts are, have been, will be, and so on. I think there's, we've faced a lot of lack of data problems in LGBT health, and this is a new one and certainly a substantial one, but hopefully one that we can ultimately address with some creative solutions, finding ways around this in other data sources, ultimately to look at what the overall impacts have been on LGBT communities in terms of caseload, deaths, and so on. Additionally, we don't have a lot of information on all of the other ways that LGBT stressors intersect with other identities. We fully expect that LGBT, that sexual and gender stressors would combine with other known health and economic disparities by race, ethnicity, by immigrant status, citizenship, gender expression, disability status, age, family and household structure. We expect all of these things. In fact, people have been writing perspective pieces all summer long about the likelihood of these kinds of things and where we would expect to see differential impacts. And I think, point one here is still going to be, we really just don't have the data that are going to enable people to look at actual health or mortality disparities here. Some other concerns are around avenues of assistance. So I mentioned that LGBTQ Americans were more likely to have lost jobs here by a few percentage points relative to the general population. We see a lot of wage loss. We have a high proportion of renters in this population. Basically, the government's continued stall on economic relief packages disproportionately affects LGBT folks right now and is causing harm to these households, families, and individuals. Additionally, many community organizations serving LGBT folks, HIV positive people, seniors in this community are bringing their best every single day, but they are maxed out. They're often staffed by people who come from heavily affected communities themselves. They were low on resources before the pandemic in a lot of cases. They already had high need, hard to reach populations who are now even more so. And they need funds to ensure that their spaces can be safe and remain open. And almost none of them received money under the CARES Act to actually help them do this if they weren't connected to a university or hospital center. Additionally, there's some missed opportunities here. LGBT people and community organizations have not been explicitly included in many governments' pandemic responses. And I think this is really a massive missed opportunity. These are the folks and organizations that have the organizing experience, the health messaging experience. They have like the sheer mobilization power of these groups and community organizations. Could really be kind of leveraged here to improve the pandemic response, and so far has not been in a meaningful or organized, systematic way. And I think this is important because we have evidence that shows that this kind of mobilization of existing resources does actually matter. So researcher Rachel Robinson has written on how in African contexts, countries that built their HIV pandemic response around existing family planning programs did better in terms of their reach, their rapidity of response, and the quality of their response. So this is something that we could do better here on in terms of leveraging existing resources and mobilizing power. And then finally, I want to kind of think about and lean into our current moment, this politicization of the pandemic response in the US, but also elsewhere, is really problematic. It's leading to scapegoating, increasing discrimination. We have some evidence from Italy that discrimination of LGBT people increased during their previous economic downturn. And so Italian researchers are anticipating a substantial bump in discrimination against LGBT people following the COVID economic downturn. Also kind of negative mental health outcomes for LGBT people, given the likelihood that these kind of experiences of discrimination will not really be addressed in a positive way by policy. Other researchers have also suggested in some of these kind of summer perspective pieces that this has been a time to expand discrimination protections, to ensure access to care, to ensure people kind of come forward and get tested and take advantage of the benefits and resources that are available. But instead, what we've seen is that some governments are, including ours, are using the pandemic really as cover to roll back rights. So in the US, we've had this removal of federal discrimination protections during the pandemic. There's been a rollback on diversity and inclusion last month, and who knows what next with Supreme Court as we go forward. I'll leave you on that note. More than welcome to address questions, thoughts, concerns, other kinds of topics as we go. Thank you so much.
Thank you so much, Tara. That was great. I'm going to open it up to questions. If anybody wants to put it in the chat, I'm happy to relay it, or you can go ahead and just unmute yourself and ask. I have a few, but I'll let others ask their questions first.
Hi, Tara. Thanks for that talk. I just had a question around kind of those final wrapping up pieces that you were bringing in about how these community organizations are well positioned to do health communications work, health outreach work. Do you know how those organizations fit into small business protections or economic relief? I don't know if there's a distinction here between a business and a nonprofit, or if they're grants, if they're eligible for this type of funding to keep their work going.
Yeah, I do not know. I mean, I work with a small business, and so I hear about it on the side end of like, we're facing all these challenges to get access to the money. So that seems like it has been difficult for some small businesses. On the like community organization side, especially working with HIV, I was looking at organizations receiving Ryan White care funding and whether or not they were able to get access to some of that CARES Act money, and that does seem to have mostly gone to more established, much larger university and hospital settings, which I'm sure likely needed some of that cash flow as well, but didn't seem to incorporate as well those smaller organizations who I assume also probably had to make some submissions about what, their budget and so on, in order to access some of that money. So that might have been a barrier for these organizations to gain some of that access, which is just like the burden of trying to get money when you already don't have a lot, I think can be challenging.
So I'll ask two questions. In the beginning, you were talking about your survey, and it looked like a lot of the data were coming from the South. I'm just curious if you have data or have seen data on regional or geographic differences, or if those patterns tend to persist, regardless of the geographic population studied.
Yeah, the first couple slides that I did were from a national study, and we do have, I think, we have 48 states or so represented in those data fairly well. And then just, one or two responses from a couple of states that we, obviously can't rely on for thinking about, what's going on there. And certainly splitting those up by region helps us quite a bit to gain some traction there and thinking about differences in response. So I think there are some initial, like in April and early May, there are differences in how people are thinking about the pandemic and what kinds of behaviors they've adopted by that time point, which I think tracks fairly well with where COVID cases were at that time, for example. So I think some of that is definitely happening, and I would expect those things to have shifted a bit over the summer and into the fall, for sure.
I guess the data you showed about trust in the government, or I forget exactly how you worded it. I'm just wondering, are there any data on approach to vaccine or vaccine hesitancy, and whether inequities will carry over to that, the way that there's been a lot of data, and I haven't actually seen this specifically for LGBTQ populations.
Yeah, that's a great question. We don't have that in our survey right now, but could think about kind of where that might go in the future. And certainly I can imagine multiple ways that could move forward. Some where, you just have at least part of a population that has a little more like health literacy or attention to kind of managing their own health and thinking through some of those pieces because they've had to, especially around HIV and things. So we have evidence that people have kind of become their own like community experts on several things related to clinical trials and so on around HIV treatments in the past. And so that could carry forward and provide some advantages there in terms of thinking about that. Could also see, greater reluctance just because of partisanship, because of avoidance of healthcare in order to avoid discriminatory experiences, those kinds of pieces.
It seems like a really important group to study because, even I think it was this week, a paper came out in JAMA and they had all these different characteristics related to religious affiliation and political views and, race and ethnicity. And this was notably absent. And given the experience in the HIV world, like you said, I think it would be really important to include.
Yeah, you'd be surprised how often people just don't include that sexual orientation or gender identity question, or on gender identity, have a very kind of basic kind of understanding of that. Yeah.
So one question came in through the chat. If you could talk a little bit about the representativeness of your survey sample in your SNAP study.
In the VU SNAP study, yeah. So,
or I guess, or in any of your survey.
Yeah, so the national sample that I first mentioned is a social media sample. Our intention was primarily to get this out quick, to get people to get as many people as possible in, to provide that snapshot. And so we're not claiming it's necessarily representative. We do skew younger than the LGBT population overall. We skew more educated, for example, but we are kind of well spread out in terms of region, well spread out in terms of education, or sorry, not education, in terms of race, for example. And so I think there are certain things that we can pick up, certain things that we expect are overrepresented. And I think some of the key pieces that come out of that is that we kind of see a lot of folks who live alone, a lot of folks who feel more isolated, despite this being maybe that more privileged kind of segment in terms of sampling.
Great.
So essentially, like, we've given you a best case kind of scenario.
Right.
Yeah, which is not all that great already. Yeah.
And I guess may vary by age, I would think, with a
Yeah, there are definitely some kind of pieces here that we would want to look more at in terms of people's variation and experiences. Some of the pieces that we were most interested in were by, whether you lived alone or had other people in your household, in terms of how you were responding and kind of navigating this new risk environment, and what other kind of challenges you were facing, since some of those pieces like job loss or benefits loss or wage loss are going to be much more problematic if you're on your own versus have kind of shared household responsibilities, for example.
Yeah. Does anybody else have any questions? Oh, yep, Nathaniel?
I was going to ask, could you speak more to your R01 about, I don't think that you had submitted the R01 you were expecting these questions, and how does this change the R01 for, the life of, it has probably 2, 3, 4 more years of data collection and time left. Yeah, can you speak to more of like that trajectory?
Yeah, of course. So we had planned initially to launch this study around March 15th. And we had planned to look at social networks of older LGBT adults in Tennessee, North Carolina, and Alabama, and really think about the ways that social networks were mitigating the effects of discrimination on health. So to the extent that you have positive social networks, you have people who are similarly identified as you, who provide affirming and supportive environments, can those relationships and interactions kind of mitigate the effects of other negative life experiences that you have, when we kind of already have this understanding of the way that those negative experiences affect health. And conversely, do negative relationships, non-affirming relationships, family who've rejected LGBT people, do those have a negative effect on your health? And do they kind of exacerbate some of the effects of those discriminatory experiences on health? So all of that is to say, when the pandemic happened, obviously we expect a lot of social network disruptions. Even by kind of early March, it was pretty obvious, like stay-at-home orders were really going to affect who you had contact with, how you had contact with them. And so, yes, our wave 1 sample will look pretty different, but I do think that some of the advantages there are that we can make some contributions now to things that matter for people. So that's certainly a trade-off, thinking about, what the impacts are for, how networks change over time. It becomes harder when your baseline is like a weird moment, right? So I think that's something that we continue to kind of struggle with and try to think about how we might resolve in our kind of subsequent waves or subsequent kind of recruitments. But I think honestly, most people involved in this project have been glad that we were able to do something to kind of collect some of this data to make it useful to policymakers over the summer who are trying to, put a good faith effort into things. So I think that's been, that balance there has been met for me as a researcher. And certainly like NIH is being a little more flexible right now. So that's at least positive as well.
Can I ask one follow-up to that? Are there any questions about people forming pods? I think that a lot of my friends up in New England have talked about like, how are they going to get through winter and how do they do that safely? Especially this older group that's already maybe facing more social isolation. Are there any qualitative or survey items or specifically about like, how do people who are anticipating this isolation, how do they navigate through that safely?
Yeah, we have some qualitative items, which you saw some of those responses from. But I think by like, March 15th or so, when we had our survey finalized, I'm not sure that pod piece was in like our lexicon yet. So we don't have that. That would be we're hoping to be done before like winter sets in with our collection. Fingers crossed. But I think that's certainly something to look for in some of those responses, like how people even over, we've been enrolling our wave one all summer. So I even expect that there are differences in how people are thinking about and responding across those 6 months, for example, that could be useful in terms of like data or thinking about, adaptations and stuff.
That makes me think about the stats you showed about the college kids. And I mean, that's really disturbing. And if you think about, there's so many exacerbations of disparities in that age group in general right now, just, people, socioeconomically, where they can be, where they're living. And then that the number, 40% or something of students whose families are unsupportive, and they're, that just exacerbates already existing disparities. Do they go home? Do they stay at school? Do they find another place to live, and healthcare and all that? I think that's really something I didn't realize the impact of that, and it's really huge.
Yeah, I think that's surprising to a lot of people. This is like that young adult period is like that prime moment of like identity development and expression, and college is one place that a lot of that happens, and it's a place kind of you're finally able to independently kind of assert that and try on different like expressions and feel that out, and to for a lot of people, I expect returning home was challenging under those circumstances. And I think, the difficult part is just kind of remembering that it's not equally difficult for everyone. And, for some people it's more difficult.
And I guess I have 2 kids in college, and I've been on a lot of, webinars and things, and students have often said that they're staying at school because it's safer for them to stay there than to go home. And so, even those decisions are really just difficult at a time when you're already struggling, and then you're at school and you may not have people there with you. And it's really.
Yeah. I mean, you're balancing a lot of risks here, right? That connection to community, infecting your family, getting infected yourself, all of those kinds of things are also balanced there. Yeah.
Well, are there any other questions? Last questions? Well, thank you so much, Tara. That was really so eye-opening, and I think we all probably realize that there's a lot of research to be done. So thank you for leading it.
Wonderful. I encourage you all to just add some identity questions on your surveys and stuff, so that you can even start to think about some of this stuff if you're not already.
Can we reach out to you for some help in designing those questions?
Of course.
That would be great.
Yeah.
Thank you.
It'd be my pleasure.
Great.
Wonderful.
Thanks so much, everyone. Thanks for joining.
Thanks, Lauren.
Thank you so much. That was really, really great. Thank you.
Okay. See you in person sometime.
I'll keep sending you the announcements. So
of course, please.
Your group. That'd be great. Thanks. Yep. Talk to you soon. I may actually be in touch with you about some questions.
Amazing.
Great.
Lovely.
Thanks.
Bye, Marie. Bye, Marie.